Today, we're doing a deep dive into Entecavir. It's an incredible medication, really a cornerstone in managing chronic hepatitis B. We're going to break down exactly how this drug literally outsmarts the virus on a molecular level, all to protect one of our most important organs, the liver. So here's our game plan. First up, we've got to know our opponent, the virus itself. Then we'll get into Entecavir's brilliant counterattack. After that, we'll walk through the practical stuff, your treatment plan, some really crucial safety warnings, and finally, what it really means to manage this for the long haul. All right, so to really get why Entecavir is so effective, we first have to understand the virus's own playbook. How does it do what it does? Well, the hepatitis B virus has one single relentless mission. Get inside your liver cells and turn them into non-stop 24/7 virus-making factories. It's basically a full-on invasion at the cellular level. Here's how that takeover happens. The virus slips inside a liver cell, and then it unleashes its secret weapon, a special enzyme called reverse transcriptase. This enzyme is the absolute linchpin of its whole strategy. It's the tool that lets the virus make endless copies of its own DNA, completely hijacking the cell from the inside out. And now enter our hero, Entecavir. But here's the thing, it doesn't just charge in and destroy the virus head-on. No, its strategy is way more clever. It acts like a molecular saboteur, brilliantly disrupting the virus's replication machinery from within. You see, Entecavir belongs to a class of drugs called nucleoside analogues. The best way to think of these is as master impersonators. They are synthetic decoys designed to look and act just like the real building blocks of DNA. And that disguise, that's the secret to their success. And here is that disguise in action. On the left, you've got deoxyguanosine. That's the natural building block the hepatitis B virus is looking for to build its DNA. And on the right, that's Entecavir, engineered to be its molecular doppelganger. This near-perfect mimicry is exactly how it tricks that critical viral enzyme. So this all breaks down into a brilliant four-step trap. First, Entecavir uses its molecular disguise. Then, it actually outcompetes the real stuff for the enzyme's attention. The enzyme gets fooled and mistakenly slots this fake piece into the new DNA strand. And that leads to the final decisive blow, chain termination. So here's the bottom line. Once Entecavir is locked into place, it acts like a permanent stop sign. The DNA chain just can't get any longer. The entire assembly line grinds to a halt, and the virus can no longer replicate. The factory is officially shut down. Okay, so how does all this amazing science translate into a real-world treatment plan? I mean, knowing how it works is one thing, but using it effectively, that's the next crucial step. So, who is this actually for? Well, Entecavir is prescribed for adults with chronic hepatitis B where there are clear signs the virus is active. It's replicating and causing inflammation in the liver. This is true whether the liver disease is in its earlier stages or has become more advanced. Now, the dose you take really depends on your personal treatment history. For most people just starting out, it's a 0.5 milligram dose once a day. But if the virus has shown resistance to a similar drug called lamivudine in the past, the dose is doubled to 1.0 milligram. That's to make sure it's strong enough to overcome that resistance. Okay, listen up, because this part is absolutely non-negotiable. This is the golden rule. Entecavir must be taken on an empty stomach. Why? Because food messes with its absorption in a big way. It means less of the drug gets into your system to fight the virus, which makes it way less effective. Every powerful tool comes with rules for safe handling, right? So a responsible treatment plan means being totally aware of the potential risks. Let's cover the most important safety warnings for Entecavir. The first major warning has to do with a rare but very serious condition. It's called lactic acidosis. Now, it's not common, but you have to know the signs. Symptoms like really severe fatigue, unusual muscle pain, or trouble breathing are urgent signals. If you feel any of that, you need to get immediate medical help. Don't wait. This right here might be the single most critical warning of all. Remember, the virus is suppressed. It's not gone. So if you stop the medication suddenly without your doctor's guidance, the virus can rebound it with a vengeance. That can lead to severe liver damage. You never, ever stop on your own. Your doctor is also going to be managing these other key factors. They'll monitor for any signs of drug resistance. They'll require an HIV test before you even start, and they'll adjust your dose if needed based on your kidney function. It's all part of keeping your treatment as safe and effective as possible. Finally, let's zoom out a bit. It's really helpful to reframe this whole journey. Taking Entecavir isn't just a short-term battle. It's about forming a long-term alliance, a partnership with your healthcare team to protect your liver for life. And this distinction is so important. Entecavir is incredibly effective at controlling the virus and stopping it from causing more damage. But it's a suppressive therapy, not a cure that eradicates it completely. The goal here is control. Success really depends on that ongoing partnership. Regular check-ins are absolutely essential. This means blood tests to make sure the virus stays suppressed, plus regular checks on your liver and kidney function, and continued screening for liver cancer. It's all part of the plan. And this is what it's all about. This is the why. When it's used correctly under medical supervision, Entecavir's true power is its ability to just halt the progression of liver disease. It can prevent things like fibrosis and cirrhosis, and it dramatically improves the long-term outlook for people living with chronic hepatitis B. So by understanding not just what to do, but why you're doing it, how this incredible molecular saboteur actually works to protect your liver, you transform from just a patient into an active, empowered partner in managing your own condition and safeguarding your future health.